If you're not happy about the way you're hearing with your hearing aids, you're not alone. Hey guys, Cliff Olson, Doctor of Audiology and founder of Applied Hearing Solutions in Phoenix, Arizona, and in this video, I'm talking about 3 reasons why you will never like your hearing aids no matter how good the technology gets. If that's you, just know that I am not disagreeing with you, but not everybody is having the same experience with their hearing aids that you are. Now, hearing aids have come a long way over the past several decades. After all, we're no longer having to use ear horns. And since 1996, digital hearing aid technology has introduced a ton of different features inside of hearing aids that help you understand speech better than ever, including in background noise. However, as the largest channel talking about hearing loss, hearing aids, and tinnitus on YouTube, I have the pleasure of seeing a lot of negative comments about people's hearing aids, no matter how much money they spent on them. If you happen to be one of those people, I want to take this opportunity to explain the 3 reasons why you probably hate your hearing aids and what you might be able to do to start loving them instead. But before I do me a huge favor and click that like button and subscribe to the channel if you haven't already. And while you're at it, down in the comment section, let me know if you love or hate your hearing aids. Okay, so according to market track data published in December of 2022, hearing aid satisfaction rates have increased greatly since 1989, where satisfaction was at 60% compared to 83% in 2022. Of course, notice that hearing aid satisfaction rates are not at 100%, which means that there are 17% of individuals out there who are dissatisfied with their devices, which is ridiculous considering what hearing aid technology can do these days. For example, hearing aids can now use Bluetooth to stream audio directly from a smartphone, a tablet, a computer, or even a TV directly into your ears. Hearing aids are now capable of artificial intelligence using trained deep neural networks to help separate speech from background noise, and sometimes doing it even better than what someone with normal hearing can do. Most hearing aids are now rechargeable to where you do not have to constantly change out disposable batteries, which is extremely important, especially if you have finger dexterity issues. And heck, most prescription hearing aids can be remotely adjusted by your hearing care professional without you having to even go into their office. So what's the problem? Why are 1 in every 5 hearing aid users dissatisfied with the performance of their hearing aids? Well, there are 3 reasons for this, and the first one is you are not a good candidate for hearing aids. You have to remember that hearing aids are only capable of restoring your hearing up to your residual hearing capabilities. What I mean is that when you look at an audiogram, the X's and the O's indicate the level of outer hair cell damage that reduces your ability to hear sounds. Whether these are speech sounds like you see on the graph, or other sounds like music or environmental sounds. Hearing aids can specifically amplify sounds inside of these frequency ranges of your hearing loss to restore audibility. However, your word recognition scores and speech and noise score heavily determine how clear sound is once it's been amplified and how good you are at separating speech from background noise. If you have high percentages on your word recognition scores, then you would expect speech to be very clear when it's amplified properly. If these percentages are really low, then it doesn't matter how awesome your hearing aids are or how well they are programmed. You will not hear speech clearly. Now, if your speech and noise score is really low, that's a good thing because that means that you need less separation of speech from the background noise before you can comprehend it. However, if you have a really high speech and noise score, it means that you need much more separation of speech from the background noise before you can comprehend it, and no hearing aid in the world can completely make up for having a really bad speech and noise score. This is why your ability to be satisfied with your hearing aids heavily depends on your residual hearing ability, because if there's a lot of damage inside of your hearing organ, or if you have issues with cognition or auditory processing, you will not get the full benefit out of your devices. Here's a trick that audiologists will often use to determine whether or not you're still a good candidate for hearing aids. We will look at your better hearing ear and the pure tone average of that ear. If your PTA is 60 decibels or higher, and in that same ear, your word recognition score is 60% or below, you may be a better candidate for a cochlear implant, not a hearing aid. I go into this cochlear implant candidacy criteria in much greater detail in this video right here that I will link in the description for you. The second reason why you are not satisfied with your hearing aids is you are not wearing the right hearing aids. Determining which hearing aids are right for you heavily depends on your hearing loss and what your specific wants and needs are. If you have ever seen any of the videos inside of my best hearing aid video series, then you may have noticed that I never rank the hearing aids, because what may be the best hearing aid for one person may not be the best hearing aid for another person. Like I briefly mentioned before, what's best for you depends on the unique characteristics of your hearing loss and the things that you want your hearing aids to do. For instance, if you have a steeply sloping high-frequency hearing loss, there are certain hearing aids that are significantly better at amplifying that type of hearing loss. On the other hand, if you happen to have a flat hearing loss or a severe to profound level of hearing loss, there are other hearing aids that are better for those types of losses. Or when it comes to specific features, if you want to be able to hear inside of a public venue that has a loop system, you better make sure you get a hearing aid that has a telecoil. Or if you want your hearing aids to be able to wirelessly connect to other Bluetooth devices, you better make sure you get the hearing aids with the right form of Bluetooth. Or if you want hearing aids that have certain accessories to help you hear better in background noise, like with remote microphones, or if you want to stream audio directly from your TV into your ears with the highest sound quality possible, you better make sure you get hearing aids that have access to those features. I could literally go on forever about all of the different considerations when determining the right hearing aid for you, but this usually takes me multiple hours inside of a consultation appointment to identify the exact right ones. And if your provider is the type of provider that just picks whatever brand of hearing aids they typically work with, no matter what your hearing loss is and what features you're looking for, then chances are you're not going to be satisfied with your devices. But the third and biggest reason why a lot of people are dissatisfied with their hearing aids is that their hearing aids have never been fit and programmed properly by a hearing care professional who follows best practices. I talk about this all the time. If your hearing care professional does not follow comprehensive audiologic best practices, then there is a 0% chance that you are hearing your absolute best with your hearing aids. Unfortunately, based on hundreds of interviews that I've done with hearing care professionals across the industry, I estimate that less than 5% of hearing care professionals are following best practices that have been established by our professional organizations. Best practices are essentially the gold standard when it comes to selecting, fitting, programming, and providing aftercare with your hearing aids. And they are the only way to ensure that you hear your absolute best with your devices. Why wouldn't your hearing care professional follow comprehensive audiologic best practices? Simple. They take a lot of time, they require specific equipment, and they require a certain amount of expertise to complete. For instance, real ear measurement can take anywhere from 10 to 20 minutes depending on the complexity of your hearing loss, and some hearing care professionals do a complete fitting within 15 minutes. On top of that, the equipment to be able to perform real ear measurement can cost anywhere between $10,000 and $20,000, and some hearing aid clinics are like, I'm not spending money on that when people would just buy our hearing aids without it. And even if they do get the equipment, it requires a lot of specialized training to perform real ear measurement properly, otherwise it could actually make you hear worse. Of course, this is not my opinion. Real ear measurement has been backed by decades of research proving that it is the best way to ensure that your hearing aids are programmed properly to your hearing loss prescription. And it results in significantly better speech understanding in quiet situations and even background noise situations compared to hearing aids that were not programmed with real ear measurement. Another one of my favorite studies, completed in 2012 by doctors Ron Levitt and Carol Flexer, revealed that an old analog hearing aid programmed using real ear measurement was able to outperform modern digital hearing aids in background noise when those modern hearing aids were not programmed using real ear measurement. In this graph, the shorter the bars, the better the hearing aid performed in background noise. As you can see, all of the black bars indicated that 6 modern digital hearing aids, when programmed to manufacturer first fit settings without real ear measurement, performed worse than the same hearing aids programmed to an NAL-NL1 prescription with real ear measurement, and that the old analog hearing aid outperformed all of the modern digital hearing aids if real ear measurement was not performed. All of this data clearly indicates that your satisfaction with your hearing aids heavily depends on whether or not your hearing care professional follows best practices. Of course, real ear measurement is only one of many best practices that should be performed by your hearing care professional, and considering the low compliance rates of professionals following best practices, it's no surprise that there's so many people out there who just don't like their hearing aids. On top of that, even people who are satisfied with their hearing aids would be even more satisfied if best practices were followed. This is exactly why I started Hearing Up. Hearing Up is a network of hearing care professionals who have been vetted and are committed to following comprehensive audiologic best practices to ensure that you can hear your absolute best with your hearing aids. Whether you live in the United States or Australia, going to hearingup.com and finding an exceptional hearing care professional in your area that follows these best practices is probably the best decision you could ever make when it comes to treating your hearing loss. Thousands of individuals with hearing loss have already experienced the difference that a Hearing Up provider makes. Now it's your turn to experience the same thing. At the end of the day, the way I see it is you have two choices. You can continue to be dissatisfied with your hearing aids and blame the technology for not being perfect, or take matters into your own hands and go to a hearing care professional who can identify if a hearing aid is actually your best treatment option, and if it is, which hearing aid is best for you, and while they're at it, make sure that they fit and program those hearing aids following best practices. Of course, if you decide to go with choice number 2, just expect to start loving the way you hear.